Welcome to this explainer. Today, we're diving deep into one of the absolute most remarkable and honestly totally misunderstood systems in the human body, the urinary system. We're going to break down exactly how it works, what happens when it breaks down, and ultimately what you can do to protect it.
Okay, let's dive into this. If I walked up to you and asked, hey, what do your kidneys do? You'd probably just say, they make urine, right? And yeah, you'd be right. But what if I told you they're also quietly working behind the scenes to regulate your blood pressure, balance your blood's pH, pump out hormones that literally tell your body to make red blood cells, and even activate vitamin D to keep your bones strong? I mean, they are absolute multitasking powerhouses. And to pull off this kind of physiological magic trick, every single human kidney relies on a genuinely awe-inspiring scale of engineering. Inside just one of your kidneys, there are about 1 million microscopic filters. They're called nephrons. Think of them as a million tiny, highly intelligent biological water treatment plants working 24/7 to clean your blood. 1 million. So here's our roadmap for today. First, we'll look at the master filters themselves. Second, what happens when kidneys fail? Third, diagnosis and interventions. Fourth, dialysis and transplants. And finally, number 5, protecting your kidney health. All right, let's kick things off with part 1, the master filters, and take a look at normal kidney physiology. And this brilliantly illustrates exactly how this chronological journey works. Your kidneys really are the ultimate biological filtration plant. So blood rushes in through the renal artery and hits the glomerulus, which is this tiny little cluster of blood vessels inside the nephron that acts like a sieve. From there, the kidney pulls out waste to form urine, all while meticulously tweaking your water levels. Next, it balances your electrolytes, stuff like sodium and potassium, and ensures your acid-base balance is perfectly dialed in. And finally, if it senses your blood pressure dropping, boom, the kidney releases an enzyme called renin to bump it back up while simultaneously pumping out hormones for red blood cells. It's this perfect continuous loop. But what happens when this intricate machinery breaks down?
Which brings us to section 2, when kidneys fail, looking at common kidney diseases. Now, what's really interesting about this slide is how it breaks down the two main ways kidney function actually declines. On one hand, we have acute kidney injury, or AKI. This is sudden. It happens fast, maybe from a severe infection, extreme dehydration, or a bad toxic reaction to a drug. But the good news, if you catch it and treat it quickly, AKI is often totally reversible. On the other hand, though, we have chronic kidney disease, or CKD. This is a slow, creeping decline that moves through 5 stages until it reaches end stage. The damage here is permanent, which is exactly why slowing it down early on is the ultimate goal for doctors. So what's actually causing all this damage? Well, it's basically a massive domino effect. Conditions like diabetes and hypertension, high blood pressure, are by far the biggest culprits. Think of high blood sugar and high blood pressure like a tiny hammer, just slowly battering those million delicate nephrons we talked about earlier. Other major risks include recurrent infections, kidney stones blocking the flow, autoimmune diseases, or even something as seemingly harmless as the long-term use of everyday over-the-counter NSAID painkillers. To really ground this, let's look at a real-world scenario. Picture an older adult who's been managing diabetes for, say, 20 years. Over time, those constantly elevated blood sugar levels have quietly, silently damaged the blood vessels inside their kidneys. Now, because the kidneys are so incredibly resilient, this person might not feel a single symptom during the early stages of CKD. But as the disease creeps into stage 3 or 4, the nephrons just can't keep up anymore. Fluid starts building up, toxins accumulate in the blood, and this overwhelming fatigue really starts to set in. And when the system is struggling like that, a chronic issue can suddenly flip into a full-blown crisis. I want to be absolutely clear here. These are real, drop-everything emergency warning signs. If someone completely stops being able to urinate, gets severe pain in their flank or lower back, spikes a high fever with chills, sees visible blood clots, or suddenly becomes confused, struggles to breathe, or has chest pain from fluid buildup, there is no waiting around. They need immediate, urgent medical intervention. This is the body flashing its red warning lights that the filtration system has hit a critical failure point. But thankfully, modern medicine has a pretty amazing toolkit for this. Let's transition into section 3, diagnosis and interventions, to see how doctors identify the exact problem. Okay, consider a young adult arriving at the emergency room with agonizing, sharp pain in their side and back, and it's radiating downward. People often describe this as literally some of the worst pain a human being can experience. This is your classic presentation of a kidney stone.
It's a hard, jagged little rock made of minerals and salts that formed inside the kidney, and now it's painfully blocking the flow of urine in the ureter. The medical team needs to figure out exactly where this stone is, how big it is, and what kind of havoc it's causing.
Let's move to and see how this builds into a complete diagnostic picture. Doctors start with simple but really powerful tools: blood tests checking for creatinine and BUN. These help calculate what's called the eGFR, which is basically a score of how well those filters are still working. A quick urinalysis checks for blood, protein, or infection. From there, they escalate to imaging. An ultrasound or a CT scan gives them this high-resolution 3D map to find exactly where a blockage, like our kidney stone, is hiding. In trickier cases of actual tissue disease, they might even go in with a cystoscopy to look directly inside the bladder or do a kidney biopsy to examine those nephrons up close under a microscope. But what happens when these tests confirm the worst? That the kidneys have permanently failed.
That takes us to Section 4, Dialysis and Transplants, the end-stage interventions. Frame this scenario in your mind. Imagine a patient arriving at the hospital whose kidneys have almost completely given out. Toxins are building up to incredibly dangerous levels in their bloodstream, and fluid is actually pooling around their lungs. This is end-stage kidney disease, and it is a wildly intense, life-threatening situation. Without functioning kidneys, this patient needs immediate artificial life support just to do the job their organs simply can't do anymore. And that life support? It comes in the form of dialysis. There are two main paths here. In hemodialysis, the patient's blood is quite literally pumped out of their body, run through a highly specialized filter inside an artificial kidney machine, and then safely pumped back in. It's incredibly effective, but it usually means spending hours at a clinic several times a week. Peritoneal dialysis, on the other hand, is just fascinating. It actually uses the patient's own biological anatomy. The inside lining of the belly, the peritoneum, acts as a natural filter. A cleansing fluid goes into the abdomen, absorbs the waste, and is then drained out. It offers a lot more freedom and can often just be done at home. Now, while dialysis is an amazing life-saving bridge, the ultimate fix for end-stage renal disease is a kidney transplant. This means surgically implanting a healthy kidney from either a living or deceased donor. And because, get this, you really only need one healthy kidney to live a totally normal life, living donation is highly successful. But, and this is a big but, a transplant is a lifelong commitment. The patient has to take immunosuppressive medications every single day, forever, so their immune system doesn't attack the new organ. Even with that trade-off, transplants offer massively improved survival rates and just a phenomenally better quality of life. Seeing these extremes really makes you realize how precious these organs are. Which brings us to our final part, Section 5, Protecting your kidney health through prevention and lifestyle. You might be surprised to learn that protecting your urinary system isn't just about how much water you drink. It's actually hugely tied to how you move. Physiotherapy and functional mobility play a surprisingly vital role here. Improving your cardiovascular health through aerobic and resistance training directly protects the blood vessels inside your kidneys. Plus, for anyone dealing with urinary incontinence, specific pelvic floor muscle exercises, you probably know them as Kegels, are a totally evidence-based way to regain control and seriously boost your quality of life. So, the crucial point is that your day-to-day lifestyle profoundly impacts these master filters. From a nutritional standpoint, the recommendations are actually pretty straightforward. You want to focus on adequate hydration, lots of fruits, vegetables, whole grains, and lean proteins. What you want to limit? Excess salt, sugary drinks, ultra-processed foods, and heavy alcohol use. Now, a quick caveat here. Actually, if someone already has advanced chronic kidney disease, this diet has to be highly personalized by a doctor because they might need to strictly cap their intake of potassium, phosphorus, and even specific fluids. Let's quickly sum up your preventative game plan. Control your blood pressure and manage diabetes. Those are hands down the two biggest threats. Keep a healthy weight, stay hydrated, and please don't smoke. Smoking wrecks blood vessels, and as we know, your kidneys are absolutely packed with them. Be super cautious with popping too many over-the-counter NSAID painkillers because chronic use is a fast track to direct kidney injury. But most importantly, don't skip your regular medical checkups. Simple blood and urine tests can catch kidney disease literally years before you ever feel a single symptom, giving you the chance to stop it right in its tracks. Which leaves us with this final thought. Your kidneys and urinary tract are performing a million microscopic miracles every single minute of your life. Seriously, don't wait for a crisis to appreciate these unsung heroes. As we've seen today, protecting your kidneys today helps protect your overall health for life. But honestly, it makes you wonder,
If our bodies are capable of this level of microscopic automated engineering, what other quiet miracles are happening inside you right now that you're completely ignoring? Thanks for hanging out with me for this explainer. Now go drink a big glass of water and take care of those master filters.